Sickle cell disease is the world's most common blood genetic disorder.
Crescent or sickle shape that can block blood vessels and lead to intense pain.
People with sickle cell disease really will be punching the air today.
Let's cross fingers. You don't know, because there's nothing you can do, because it's not a disease that can be cured.
But it's like I'm actually having another crisis, and that's how it feels a lot of the time. It's very frustrating.
Now I'm going bald. Now I have infertility problems. Now I'm going blind.
Sickle cell, in one phrase, is the unseen fight.
You made me who I was, not what I become. You made me who I was. Go make another one.
So sickle cell is a blood disorder that is hereditary. So you can get it from both parents, and it affects your blood cells. So usually your blood cells are round, but with sickle cell, your blood cells are a crescent shape. So it's like a half moon or like a banana. These cells are very sticky and they're quite rigid. So when they pass through your blood vessels, they can get stuck. And when they get stuck, this causes a sickle cell crisis. So this sickle cell crisis is intense pain, like excruciating pain, and it feels like tiny glass shards in your body. So basically your blood is like glass. So it's constant throbbing pain. It feels like almost like you're on fire, and it's very, very painful.
I was crying all the time, because I was in hospital, and I would see people, they finish school, they would come and visit me, my friend, and then they would tell you what is happening in school, what they have done, and you are powerless. And I was crying my heart out. Until today is a year that when I remember the sadness in my spirit.
My name's Nicole. I'm a pharmacist with sickle cell. My parents were not 100% educated in regards to sickle cell and the issues that come with it. It didn't help my sort of development as well. So I was years without taking my medications, and also because of my slow development, my bladder wasn't fully formed until I was like 15, 16. So I was like wetting the bed, and my parents thought it was me being a nuisance and me being a child, and they would throw tantrums about it and I would get punished. But really and truly it was just because of my sickle cell.
My lungs feel like they're gonna break. I don't even have the energy for anything, so I need to try to eat, and I've been like vomiting and whatnot, and the pain is just nuts. My chest is doing a madness. Even got this little tool thing to help my breathing.
You have a choice between, do I work, earn a living, but have my health just completely deflate, but rely on painkillers? So you're constantly on painkillers, constantly high, constantly drowsy, and I'm still having to function. And then me function around kids, it's just, you can't do that. You can't. So I would literally just not do that at all. I'll be in so much pain, but I'm like putting on a brave face and pretending that everything's fine and I'm happy and I'm okay. And not obviously take my painkillers, because I don't want to be under the influence, especially when you're working in schools. You can't do that. But it's very difficult to work under that pain for so many hours and then also feel the effects of it. Because even if I'm not on those opioids or those painkillers, I'm on my other medication anyways, and that still gives me different side effects. So either way, I'm still feeling not normal, I'd say.
I was pregnant with the girls, and due to the complications of twins, during my pregnancy, I had a lot of bleeds, so I was going back and forth to the hospital anyway. And the reason I was having a lot of bleeds is because the placenta for the first twin was attached to my previous C-section scars. That was causing a lot of bleeding. It's called placenta accretus. So it was causing a lot of bleeding, which was dangerous anyway. So I'd gone to the hospital for my blood exchange, actually. Had gone into hospital, come back home, and I started getting a lot of chest pain. My son was downstairs, the boys were downstairs, and I literally couldn't breathe. Literally could not breathe. And the pain was so bad. So I told my son I was going to come sleep for a bit. But I literally couldn't sleep because of the pain. So I called the paramedics. Paramedics said that they were going to come, I think they said half an hour or something like that. So I called my son to come upstairs, and he just stayed with me the whole time. And then we had to call the paramedics again because the pain was getting worse. And then that's when he spoke to them and said, my mummy can't breathe. And then he let the paramedics in. And he was able to explain to them what had been happening, obviously in 6-year-old language. But he was able to explain to them what's happening. And then they literally came in, did the vital checks or whatever. By that time, my mother-in-law had got to us as well. And then we were able to go to the hospital.
But to be honest, I can't stay, no, no. You made me who I was.
It was distressful, basically, because when you look at your own experience, you will never wish that anybody goes through that. Okay, but we found out that he has it, and it was distressful. It's like oh, let's cross fingers. You don't know, because there's nothing you can do, because it's not a disease that can be cured. But the only hope was God heal my son. It's very difficult to know that my son is suffering because of me.
And I can admit that before I had Bradley, I didn't know that I have sickle cell trait. It's after I have Bradley that I know I am a carrier. But unfortunately, as a mother or as a nurse, because I'm not his nurse, you are helpless. There is nothing you can do. There's not much you can do from home.
It's the worst place to be. It is a terrible experience. Thinking you're screaming and crying for no reason.
You made me who I was.
Even as a nurse, not all the nurses that understand the condition. And sometimes it makes me feel bad, because when he's in pain, they don't understand it. The pain is the level of the pain is so high that he often asks for painkiller. But for them, they don't understand. Oh, why is he asking all the time for the painkiller? They don't understand that pain.
There's not enough being done. There is a stigma over people with sickle cell, and that needs to be eradicated from the healthcare industry. And I feel like until that stigma is eradicated from the healthcare industry, people with sickle cell are going to continue to suffer.
Sickle cell patients are dying because of the lack of care, the lack of education from these medical professionals, these doctors, these nurses, acting as if we are drug seeking or our pain, we're over exaggerating when it comes to our pain, when they wouldn't even be able to cope 1 second with the sort of pain that we do go through.
To be honest, I can't stay, no, no. You made me who I was. Who I was, who I was. No.
I also would like government to respect sickle cell as well, because I feel like people with sickle cell that were born with it through no fault of their own shouldn't have to be paying for their medication.
On your death certificate, it will say, oh, they passed away from, I don't know, a heart attack or kidney infection or something, when realistically they died from sickle cell. This happened because of sickle cell. Their heart failed because of sickle cell. Their liver failed because of sickle cell. Their kidneys failed because of sickle cell. And it's not talked about. And the fact that it's not listed on your death certificate, again, gives them more reason to not make it seem like it's serious.
was distressful.
You are helpless.
It's a battle, I would say.
It's difficult to navigate.
Naked to the human eye. You can't see it, no one can see it, but it's something that we are consistently fighting all the time.